Well, I'm bringing my mom to the ER.
With his mother sick, Joe Trejo of Aranzas Pass at her bedside here at Christus Pond shoreline, kidney issues to blame.
It's exhausting. My mom's just tired all the time.
She may be tired from the testing, but needs to be treated in the hospital.
Well, they're running tests as far as we know.
Joe's mom, unlike countless others who now get treated virtually through telehealth. Virtual appointments not only convenient for patients, also helping hospitals cope with staffing shortages. And even Joe uses it.
What's it like for you?
It was pretty convenient,
And Trejo hasn't just used telehealth here in the Coastal Bend. On a recent trip to California, he got sick, logged onto telehealth, and within 20 minutes, he had the medication he needed.
Trejo isn't alone. At Christus Trinity Clinics between March of 2020 through last month, 17% of patients use telehealth. And out of all Christus patient visits, 6% of them are virtual. Over at Driscoll Children's Hospital, more than 45,000 telehealth visits since March 2020 in all specialties, and also now integrated into the emergency rooms.
What is the primary reason, do you believe, that people don't want to go to the ER these days?
I think that the recent Omicron surge is certainly to blame.
Dr. Colin Banyas is Chief Medical Officer for Dr. First, a health IT company. He says it's all part of the new age we're living in.
It relieves some of the unnecessary burden on emergency departments.
You talk about an ER visit, that the price is kind of off the charts.
So visits to the ER can be staggeringly expensive, even for the mildest of conditions.
At a person's house, a car crash, a heart attack, even bringing in the ER physician to assess the situation. Does the patient need to come to the busy ER or just go to their primary health care doctor?
There's only so much data that I can get from afar. Whereas if I have you in the office, there's a variety of tests and things that I can do in person.
Other benefits, not having to travel to the doctor's office or even taking time off from work. As for Joe, he keeps a close eye on his mom, and when it comes to his health,
You need a doctor on site sometimes, and what would be the difference if he's there in person or not?